So you've tried some natural and behavioral ways to combat your child's constipation and you're stuck. I'm Dr. Mona Amin, a board-certified pediatrician and mom. Welcome to my channel and make sure to subscribe. We're discussing both non-medical and medical treatment of constipation. If you're not sure if your child is dealing with constipation, refer back to my latest video where I discuss the definition of constipation, the causes, symptoms, and lifestyle modifications for preventing constipation. Let's get to today's video. Now, as I discuss treatment throughout this video, it is important for you to know your child's bowel routine and habits in order to offer them the appropriate treatment. For instance, I know that my son usually has a bowel movement every day. If he goes one day without having a bowel movement, I will take a less aggressive, non-medicated approach to helping him have a bowel movement. If he continues to go another day or two without a bowel movement, I will need to use some medications. Same thing for my daughter. I'm monitoring stools as a big picture. When I approach constipation, I like to work from above before doing rectal therapies. So this means diet and lifestyle modifications or medications by mouth before we reach for suppositories or enemas in a hospital. As we discussed in my previous video, lack of fiber and dehydration can cause constipation. One of the simplest ways to treat your child's constipation is by making sure that they have enough fiber and water in their day-to-day diet. Increasing fiber through things like fresh fruits and vegetables, eating a variety of these types of foods can help make it easier for stool to pass through your child's intestines, therefore helping to treat constipation. Here are some fiber-rich foods and foods that can help with constipation. You can also consider decreasing the number of binding foods in your child's diet. This can include white breads and pastas, processed snacks, milk, cheese, and ice cream, unripe bananas, and fried food. These tend to have low fiber content and can make some kids more sensitive to constipation. Lack of water also hardens stool. If you are noticing that your child is constipated, increase their water intake. If they are an infant, breastfeed and formula feed on demand or per their routine, and supplement water if over 6 months at meals. I know you probably knew this, but it is important to have a varied diet and hydration. And I also recognize that some children are more restricted in their intake than others, which is why this video will go over other treatment options as well. My go-to natural remedy for constipation is prune juice. Since the kids were infants, I would give 4 ounces of prune juice for constipated episodes. This was only as needed, and if I noticed that they were off their baseline and straining to go. Prune juice is an old school remedy, but it packs a lot of fiber. It does have sugar, but it's not added sugar, so comes with the fiber content of prunes. However many months your child is, you can give 1 ounce of prune juice with no more than 4 ounces a day. So if your 3-month-old is truly constipated, you can give 3 ounces. But if this is your first constipation issue, speaking to your clinician is best before proceeding. Besides prune juice, we increase fruits and veggies with high water content, such as watermelon, cantaloupe, berries, and cucumber. Make sure you watch my first video on constipation for behavioral and psychological coaching of constipation. This is key, especially if your child has felt pain with a prior bowel movement, which they most likely have. That fear can make it so that they do not want to stool, so coaching them through the pain combined with softening the stool can help. Even if your child isn't potty trained yet, they sense your encouragement to pass a stool. If you see your diaper-wearing child make their poop face, encourage them. Yes, you have to poop. Come on, let it out. It will make your belly feel good. If they're potty trained, holding their hand and reassuring them can help, and putting their feet on a stool so their body is positioned better to handle stooling can help. If you find them straining or disappointed that they can't go, say, "We can try again later," versus forcing them to stay on the toilet if nothing is happening. To help relax the pelvic floor, you can also have them blow into a squiggly straw. These behavioral modifications and coaching can really help overcome the fear they have by being their constipation doula. Check out my first constipation video for more. Now, you're going to focus on the psychological and behavioral aspect of constipation. But for some kids, it may not be enough. You may need to soften the stool with medication so it doesn't hurt them, and sometimes the poop can be so backed up that it needs over-the-counter or prescription medication to help the constipation. Discuss the use of these treatments with your child's clinician, who will create a constipation action plan and discuss exact dosing. Research shows that such plans benefit both children and parents. This plan outlines the type and amount of medication needed to relieve and manage constipation, especially in cases of chronic constipation. Some of these medications are over-the-counter and some are by prescription. The goal is to maintain regular bowel habits for a few months before gradually reducing any maintenance medications. If your pediatrician does not provide this plan or you feel is unable to manage your child's constipation, a gastroenterologist can help if you need it. Stool softeners are a type of over-the-counter medication that work by increasing the amount of water absorbed by the stool, therefore softening it and facilitating an easier bowel movement. A common stool softener for kids is docosahexaene sodium, also known as Colace. Stool softeners generally provide gentle relief compared to other medications because they don't cause the intestines to contract, therefore causing less cramping or urgency. This can be gentler on digestive systems and suitable for long-term use. Colace can be slower acting than other medications. Some side effects, however, may include mild cramping and diarrhea if the dose used is too high, hence why a clinician should oversee dosing. Osmotic laxatives are popular for children as they relieve constipation by drawing water into the intestines to soften stool and stimulating intestinal movement to promote bowel movements. Like I mentioned in my first constipation video, it helps with the two most common causes of constipation: water loss from stool and decreased motility due to stool buildup in the colon. These laxatives are generally over-the-counter but are also available by prescription. Common examples of osmotic laxatives are polyethylene glycol or Miralax, lactulose, and magnesium hydroxide. Polyethylene glycol, or PEG, or Miralax draws water into the colon to soften stool and increases bowel movements. Lactulose is a type of sugar that helps draw water into the bowel, making stool softer and easier to pass. Magnesium hydroxide chewables are our go-to for our son after he could chew medicine. If he's ever not regular, and especially on vacation where he gets traveler's constipation, we give him these daily until the stools return to baseline. Again, the key is knowing what bowel habits are normal for your child so you can stay on top of it. They can be used long-term for prevention in chronic constipation. Possible side effects of these types of medications include bloating and gas and diarrhea if too much is taken. For more information on the popular and commonly used medication Miralax and specific safety concerns with this, see my video about Miralax. Stimulant laxatives treat constipation by stimulating the bowel muscles to promote movement. Common stimulant laxatives in children include senna or Senokot or castor oil. Castor oil contains ricinoleic acid, which stimulates the muscles in the intestines or peristalsis. This stimulation increases the movement of the bowel, helping to propel stool through the digestive tract. The evidence shows that stimulant laxatives are safe for children. Children do not develop a dependence after short-term or long-term use of these stimulant meds. These medications work quickly, and therefore it is encouraged that your child is near a bathroom if they are given these medications. Common side effects of stimulant laxatives are cramping and discomfort, and diarrhea and dehydration if the dose is too high. Rectal therapies include suppositories, which give medicine directly to the rectum, and enemas, which give medicine higher into the colon to provide additional hydration, lubrication, or stimulation to evacuate poop. My favorite over-the-counter suppository is Pediatric glycerin suppositories. It helps lubricate the bowel and induce a bowel movement. It can work as quickly as 10 minutes. This was my go-to in the toddler years for my son. It should only be used as needed and not as maintenance, so this was a medicine we took on trips when our son would get traveler's constipation. When using suppositories for your child, be sure to insert with a clean finger. These are more difficult to use with infants, as the suppository has to be retained for a little bit to be able to take effect. Because of this, it is generally not my favorite to use in infants. If you want to use it for your infant, you must speak with your child's clinician first, as these are usually recommended for kids 2 and up. Evidence shows that enemas are equally effective for fecal disimpaction or a clean-out as Miralax, but should not be used as the first choice for daily maintenance therapies. Enemas are typically done in emergency rooms or by visiting nurses at home for chronic constipation kids with chronic medical issues. They can work fast to alleviate acute constipation. Long-term or frequent use can lead to dependency or irritation of rectal tissues. Side effects include rectal irritation, cramping, and diarrhea. Treatment for acute severe constipation typically involves 3 steps. Initial clean-out. Medications such as Miralax are used for 1 to 4 days to remove the buildup of stool. Maintenance therapy. Once the child has passed stool regularly, daily medication keeps stool soft and prevents buildup, helping the colon return to normal. Regular bowel movements and diet modifications and hydration should always try to be encouraged. And step 3, counseling and behavior modifications. This helps address any emotional or behavioral issues related to constipation and soiling. The duration of this depends on each child, as every child responds differently to constipation management. Of note, 2 children could have the exact same diet, exercise, and hydration status, and one can be more prone to constipation. Make sure to watch my first video on constipation for more signs and symptoms to seek an evaluation, but labs and imaging may be warranted if your child has any of the following: prevent and treat constipation in kids, focus on a diet rich in fiber, plenty of water, and regular physical activity. Support your constipated child psychologically and emotionally by encouraging them through the pain, but also softening the stool if needed. If constipation persists, consult your child's clinician for guidance. What things have you done to help your child's constipation? What medications or regimen work best for your child, and what was in your child's constipation plan? Have any general questions? Drop them below, and if you found this video helpful, make sure to share this video on social media, hit that thumbs up sign, and subscribe to my channel to stay up to date on our twice a week videos being published. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.